want to welcome you to Valleywise Health. We're excited about being able to tell you about our health system. We are our community's public safety net system of care and teaching hospital. We've been here for over 145 years. So with that history and that legacy, how we've changed over the years. We have kept up with the technology and we've grown with our community, and we're very excited about telling our story to you today.
I will never forget the tour that I did over 10 years ago now. It left an impression on me that I'll always remember. But right now, because of COVID, we can't do those tours. And so we hope that these virtual tours are a way that you can see a little bit into the heart and soul of some incredible heroes that serve all of us when we need it most.
In 2014, a very, very important thing happened. The voters of Maricopa County passed Proposition 480, and that gave us the capital funds that we need to totally reimagine our healthcare system. And so as we speak today, we have almost $1 billion worth of capital projects underway, which includes community health centers throughout Maricopa County, a multi-specialty clinic that will be opening very soon in Peoria. The largest part of the project is a brand new teaching hospital. That's important because it will give us the state-of-the-art facilities that we need to house the Arizona Burn Center, which is one of our prominent centers of excellence, a new trauma center, a new emergency department, and facilities that we can all be proud of.
It is absolutely incredible that in the face of this global pandemic, which we're one of the leaders for the Valley and taking care of people, we're still going to have a new Arizona Burn Center. We're still opening our new clinics out in the West Valley. And this is just incredible that you have people that are still showing up to get it done every day.
The new Arizona Burn Center is going to be one of the largest burn centers in the United States. It is going to be the most progressive, most modern, and is going to have a number of unique features that is really going to allow us to take care of burn patients, not only acutely, but long-term. It is going to be the state-of-the-art, the epitome, the burn center that every burn care professional would want to have.
The new Arizona Burn Center currently under construction is a very, very exciting opportunity for us to really find a way to engage our patients at a different level, where we can concern ourselves not only with rendering care on a daily basis, but we can design an entire unit from the patient's perspective and from the perspective of the healthcare system, looking at current initiatives and future requirements. The conventional model would be to break things down into individual pieces. So you have need for PTSD counseling. You have need to meet with your surgeon to talk about reconstructive surgery. And these are provided in separate buckets at separate places at separate times. What we want to do is we want to bring all those functions, all those features into one location. So it provides those patients with access to the full firepower of the entire care team instead of bits and pieces of it that they might get someplace else.
Taking care of burn patients is complicated and resource intensive. And the Valleywise Health Foundation has been really instrumental over the years in helping us provide things for our patients and their families based on what they need and not what they can afford.
Ultimately for us, our goal is to return people to their prior functional level, returning them to work, their hobbies, their enjoyments, so life is worth pursuing for them. Life doesn't feel that much different. And to get them to that point requires input from a lot of professionals, requires the equipment and the space and the time and the engagement to do that. So being able to have the space and then potentially the resources to engage those things is very exciting for us. The new Arizona Burn Center, we will have hyperbaric chambers, a wellness center. We will have a dedicated peds wing for pediatric patients, a pediatric playroom and a teen playroom. We have child life specialists who will work with those patients as well as a therapist. We're trying to set the bar so high here that anybody who wants to enter burn care in Arizona has to match our level of investment in our survivors and investment in our patients. So if I'm a burn survivor, I know I can go here and I can get all my questions answered. I can get all my needs addressed.
Valleywise Health is an academic health system Our prime mission is education of the next generation of healthcare professionals. The buildings are a key piece to the puzzle, but it's only one piece. We need to continue to invest in the people, in the operations, and in the equipment to maintain the state-of-the-art care that is truly necessary to serve our patients, as well as educate the next generation of healthcare professionals. Valleywise Health, in partnership with Dignity Health and the District Medical Group, have entered into an alliance with Creighton University to create the Creighton University Arizona Health Education Alliance. Partnering with a large academic organization hopefully will bring the resources and attractiveness to Arizona to be able to recruit the best and the brightest students that will therefore hopefully stay and practice medicine within the Valley and within the state of Arizona.
Residents and students want to come here for a lot of reasons. Number one is autonomy, meaning they gain autonomy that is granted to them by our faculty as they go up in the level of training. The learners here are exposed to more in this institution than any other institution in the Phoenix metropolitan area. We do everything well. We have nationally recognized faculty here. We have the patient load and complexity to satisfy the desire of any resident or student who wants to learn from us. But our mission, our goal, and our aspirations are to be the best that we can be, and that's who we recruit. We want the best here.
The program has been very well known throughout the country as being one of the top-notch programs in emergency medicine. In the past, we had 14 residents per year, and now that has increased to 16 residents per year. We screen well over 1,200 applications for those 14 to 16 spots each and every year. Now, as we're designing the new emergency department in the hospital, we're going to have a lot more space, a lot more rooms to treat patients, even some state-of-the-art things that we don't have now that hopefully we can incorporate in the next few years to try to make this a state-of-the-art emergency department.
Well, as the number of coronavirus cases continue to multiply in Arizona, we know hospitals and healthcare workers here are getting set for the long haul.
We've had to adapt. This new pandemic that has changed the way healthcare is done all the way across the country, all the way across the world, especially with us in the medical center as well as the ambulatory care centers. You know, we all have to change and adapt, and I think it's important for us to be able to do that.
One of the core tenets is to be transparent around what we are seeing and what we're experiencing as a healthcare system. It's important to educate the public that we are seeing a number of cases, educate how we can then protect the public and understand how this disease is transmitted, the importance of, wearing a mask in public, maintaining those social distancing to mitigate or decrease the spread of the virus. Being able to be here and able to provide that reasonable and factual information is one of the reasons that we truly exist within the community to be able to provide those resources.
We are on the forefront, using our resources to be the best we can be in the city. And for this pandemic, it's just setting us up for success for the next one. We don't look at it as a negative. We look at it as an opportunity for growth and education of our own people and our own processes. We will make the next pandemic even easier on the people, both patients and staff, here at Valleywise.
In Maricopa County, we have been providing inpatient behavioral health services for quite some time. The goal with that service is to help treat people when they can't see what's going on with them, so that folks are handled in a medical or mental health manner versus the legal system or other things. We started out with just one hospital, and now we have 3. And so there's one located here on the main campus. It's our Phoenix location. And there's one in Mesa. And then our most recent one is at Maryvale. We've just expanded that hospital over about the last year. There's been a lot of development, and we're really excited about the services that we're able to provide our population. So we started with an ACT team, which is an assertive community treatment team. And what they do is help folks that have severe mental illnesses, as well as other socioeconomic factors that affect their health. Our second foray was into what we called First Episode Center. What we do there is help young people who have the beginning of schizophrenia or psychosis, and we help them get back on track for their life. So it's a really innovative, fun program where we just really help people understand the diagnosis of schizophrenia, as well as how to manage it and how to normalize it, treat it just as a health condition they need to learn to deal with, and how they can get back to their normal life. Our third program is our Mesa Behavioral Health Specialty Center, and that is for people that have a serious mental illness, but don't need quite the level of services that might be needed for that ACT team that I mentioned at the beginning. And then our most recent is our integrated behavioral health. We all know that it's great to get all of your services in one place, and we also know that there's a significant need for folks in primary care settings to address behavioral health needs. So there's an integrated behavioral health clinician and an integrated behavioral health specialist that can provide some, brief counseling, interventions for grief, stress, mild anxiety, mild depression. Not only do folks have ongoing issues that they are getting treatment for, but now we have this additional stressor of the COVID-19 virus and how people's lives are changing. So we were able to upstand telehealth services, which is incredibly important, to be able to still identify with people and connect with them during this very difficult time.
We know telehealth needs to be a significant part of how we design our clinics. People generally have these devices in their homes. They have smartphones. So suddenly people now have easy access to our system, this very easy way to get in touch with our care team and our provider. So about 40% of our patients right now are being seen virtually. I would not be surprised if that ratio continues. I suspect we'll have an element of telehealth forever. We want it to become part of the fabric of how we provide care. Both our attendings, our residents, even our medical students are participating in these visits. So suddenly we have this whole palette of tools extending from the home to the clinic, and we're trying to take advantage of that as best we can.
As things change, we're going to figure out what works best for people. There's been a lot of positives to the ability to connect via the video or telephone chats. The other piece that I think is important is it's normalized, I think, in the community, anxiety and fear a bit more, because everybody's anxious, everybody's fearful, people are depressed about what's going on. And so I think the community at large is talking more about mental health. And if we can do that and talk about it more, it means that people will be more open to getting treatment versus stigmatizing it or not talking about it.
You may have heard the saying, your zip code is more important than your genetic code. We've been very attuned for several years now to what we call the social determinants of health. Transportation insecurities, food insecurity, economic insecurities, safety in the home. One of our goals is to be where our patients are. We just opened up a facility in Maryville last year for that exact reason. 250,000 people in that area. Telehealth and virtual visits have become sort of a leveler. So suddenly people now have easy access to our system. By incorporating those social determinants and providing that care to our community, it has a blanket effect. When I see everybody embracing it with their devices or their borrowed devices, and they're doing amazing at it, it's been very rewarding.
I got a book for us to read.
A key role in any healthcare system, and especially at Valleywise Health, is education of the entire family and the importance of healthcare and their healthcare needs. Through the Family Learning Centers, we're able to connect with all members of the family, understand the importance of early education that will lead the children to be successful.
The Family Learning Centers are an information hub located within the Valleywise Health clinics. We provide resources, we provide educational classes, parenting classes, and medical information as well. As soon as COVID-19 numbers surged in Arizona, our locations were closed. Since then, we have launched virtual online classes. We have conducted a weekly newsletter with information, virtual story time as well. We have noticed at the Family Learning Center that our families at this moment do have many needs at this time, and we are really supporting them, I think, more now than ever.
And Valleywise Health is trying to make sure everyone knows what's going on and what to do during the pandemic. That specifically includes refugees, because many of them don't speak English.
Arizona historically has been a leading state hosting refugee new arrival. And there was a great need in terms of creating a patient-centered medical home for newly arriving families that had not existed before. And so when I arrived in 2008, I was able to share this vision with our leadership. They helped me create that space to grow a center such as what we have now. Over the past 12 years, we have truly grown to be able to serve women from over 59 countries across sub-Saharan Africa, Southeast Asia, and the Middle East, as well as really create a unique model of care that builds trust with our refugee patients and families and helps to break down some of the barriers to care and navigating a healthcare system that is unfamiliar to them, Western medicine, preventive health, through our cultural health navigators. These are women who have a shared cultural and ethnic and linguistic identity with the communities that we serve. We are truly leading the charge in terms of creating safe spaces for families to receive quality care that's linguistically and culturally appropriate. You can imagine for newly arrived refugee families, English is not their first language, and often for our women particularly, they may not have had educational opportunities to go to school. And so what's novel is that we use a lot of audiovisual modalities to convey health information. And a perfect example is what we've done to respond to this COVID-19 pandemic crisis. You have to often think of novel and innovative ways that you can engage communities that are otherwise underserved, hidden, or would not be able to receive the necessary outreach and education or information, especially when we're in such a pandemic crisis as we are in right now.
No matter what language you speak, no matter what your socioeconomic background is, we want you to be part of these technologies. We're working very hard to enable all of our patients with these virtual options. We want to make it super easy. It's something that's for our patients. They're getting benefit from it, and they are loving it.
I don't think there's anything more important than healthcare. And Valleywise Health provides it to the people that need it the most and have it the least. It's our community hospital, and nothing defines a community more than how we respond to the needs of the people when they're sick, they've been hurt, and they need help that they can't otherwise provide for themselves. Our community shows who it is and what its character is all about by the way they support our community hospital. Valleywise has done a tremendous job, but they can't do it alone. They're integral to our community, and the community needs to be integral to the success of the hospital. And I don't know what could be more rewarding than giving back to a community hospital that's helping so many people.
If you want to invest in the place, the only place that can do level 1 pediatric and adult trauma and burn, one of 12 in the country, the only place that has more beds for the severely mentally ill in the entire valley, and the place that's teaching more doctors, nurses, first responders, allied health, and some critical things like burn and trauma, Valleywise is your place.
We're always going to need a safety net system of care. There will never be enough resources in order to fully fund the needs out there. So every single dollar that we're generating through philanthropic giving is a dollar that goes absolutely directly to our mission. And so with the many options that individuals and organizations have out there for their giving, you will find no greater impact through your support of Valleywise Health. Every vibrant community has a vibrant public healthcare system. And that's the role we provide through teaching, through clinical service, through research, and providing centers of excellence that fulfill a need in our community.